Hey everyone, today I want to talk to you about the role of interventional pain management as it relates to traumatic brain injuries. You know, the toughest part about a traumatic brain injury or a TBI is the T part, the trauma. Usually it's caused by some sort of accident, sporting event, car crash, whatever. And the trauma, usually in addition to causing a brain injury, causes some sort of injury to the body. And that gets complicating because when you have pain, there's one of two ways to deal with it. Your body's natural endorphins, which is its own personal painkiller, let's call it, or the use of prescription medications that are painkillers. And the problem there is that if that occurs over a long enough time, it can cause atrophy to the brain, mainly the hippocampus, and complicate the recovery of a traumatic brain injury or even make it worse. So I want to talk to you about interventional pain management. And what it sounds like can be a little complicating, but it's really pretty simple. Interventional meaning how do you avoid surgery, and in some cases, many cases actually, how to get medicine out of the regimen, because those are the two complicating factors. These can be specialized doctors. Many times it's an anesthesiologist. It could be an orthopedic surgeon. I prefer neurologists, and the reason why is because they have a particular understanding of the interrelationship between the brain and pain. So I always look for a neurologist that's board certified in both neurology and interventional pain management. Now, the interventional pain management comes in a few forms. The most benign or the most conservative form are what we call ESIs, which are epidural steroid injections. These are designed to give meaningful long-term relief to patients by use of needles. There's no surgery, there's no general anesthesia, it's very safe, so you're not complicating things. And this is a medicine that can last for, weeks to months to even in some cases maybe even up to a year. So that can be good. One of my favorites is called, in the profession, it's called an RFA, and that stands for a radiofrequency ablation. Now that sounds pretty complicated, but it's really not. It is done under local anesthesia, and a series of very, very thin wires are pushed through the skin, almost like getting a shot. And the doctor uses a live x-ray or a fluoroscope. Sometimes you'll also hear it referred to as a C-arm. And they can identify in real time the area that's affected, on an orthopedic basis or a spinal basis. And they use radio frequency waves to simply deaden that nerve about 12 millimeters. And what that does is it will give anywhere from a year to a year and a half of relief to the patient, and you're not using any medicine. So I really, really like that procedure. Now, the problem with a nerve is it's kind of like a lizard's tail, and it grows back over time. So if the patient begins to have a recurrence of pain, it may need to be duplicated. And those you can do for the remainder of your lifetime or until they cease to become effective, and then you have to look at all other alternatives, which is what I'd like to cover now. In extreme cases where the person's just not getting any relief, then a spinal cord stimulator can be used. Now, this is a pretty severe remedy, but in some cases very effective because a lot of people with TBIs suffer from headaches. And so what this is some wires that are inserted along the spine in a very, very small incision, and they kind of they're butterflied up at the base of the skull, and they're attached to a battery pack that is actually placed in the body. It only has to be replaced about once every 5 to 7 years. And a remote control can actually use electricity to regulate the pain, and it does so by tricking the brain not to feel the pain response. These three methods are very effective in controlling the physical pain of a person with a TBI, and I have found in my practice that many of these folks, after they get the pain under control, you can really begin to see some developments in recovery. It's not going to be complete and it's not going to be permanent, but I do find the symptoms are a lot better. Hey, I hope this helped out today, and we'll talk again soon. Thanks a lot.